Le Mojo Show vient joindre nous aujourd'hui grâce à support Cap Lamandou l'hôtel qui établi dans ville Jacmel ak Villa Théodore qui chita dans mi-temps Port-au-Prince dans quartier Debussy. Si ou à Jacmel, ou soit au Port-au-Prince pour vacances, ou soit pour business, et puis vous voulez descendre dans l'hôtel, côté ou à l'aise qu'on met Blaise, seul choix c'est Cap Lamandou dans Jacmel ak Villa Théodore dans Debussy. Ou ka contacter yo directement sur site web yo caplamandou.com ou soit villatheodore.com. Les Mojo Show voulait remercier John Laguerre qui c'est un supporter fidèle show. John Laguerre, c'est un professionnel qui can répondre à tout besoin financier nous, tant que assurance santé et assurance la vie. Pas quitter ces les mal arrivés pour nous dire si nous te connaît. Contactez John Laguerre dans 347 204 58 61. 347 204 58 61. Donc, Mona Lisa, c'était un coquin chaîne émission aujourd'hui, tellement apprendre en pile. Et dans ce sens-là, je pense que m'espérer n'a pas opportunité pour nous faire un autre segment et avec et inviter ça peut-être l'autre, mais et une autre émission qui est axée spécialement sur Timoun qui a besoin et spécial parce que je pense que les parents haïtiens très souvent peut-être pas comprendre et tout ça qui est disponible pour eux en termes de services. Et même si vous avez au service, vous ne pas comprendre la nécessité des fois pour utiliser le petit mounio et joindre le résultat que vous avez. Donc, sans, without wasting too much time, we have the next show. It's the next segment is ready to come on. They've been waiting in the room, and we apologize. We took a few minutes from you, and I'll let Mona Lisa do the introductions, and then I'll step out. It was great seeing. It's good seeing you.
Good seeing you too, Johnny.
Oh, I love the bow tie. Oh,
thank you. I think Mona, you're on mute.
Yes, thank you so much for your patience. We truly appreciate it. And on behalf of Johnny and myself, we just want to welcome you. Your home. This is your home. So we're just going to slide out quietly so you guys can take over. We'll be in the background enjoying the show and sharing the platform.
Thank you so much, Dr. Mona Lisa. Again, thank you, Johnny. It's definitely a pleasure and an honor to be on this platform with you guys. So without further ado, I want to begin. I want to begin by, hold on, give me a minute. For some reason, see if hello? Okay. I think we're good. We're just getting ourselves situated. Good. Good afternoon.
Good afternoon.
Good. Okay. I was just doing a mic check, making sure everyone was there. Once again, good afternoon to the Mojo Show, which Mona Lisa and Dr. Mona Lisa and Johnny Celestin is the producers. And they saw fit to have a platform for mental health. So this is mental health with ARA, and I am your host, Sony Pierre. I am the founder and CEO of ARA, Emotional Wellness Mental Hygiene, a innovative mental hygiene practice located here in Brooklyn, New York. And I am grateful and thankful to be with you guys this afternoon. As I mentioned, Dr. Mona Lisa, thank you, and Johnny, thank you. nous remercions pour chance et opportunité que tu as nous pour nous capables avec nous après-midi. C'est encore un privilège et un honneur pour nous capables porter plateforme ça pour nous, et spécialement pour moun cap écouter nous, moun cap suivre nous via Facebook et Instagram. Today I have two very special guests with us. They're special and they're dear to me in various capacities. C'est deux sœurs, bon, c'est deux sœurs curieuses, but je suis capable de dire que c'est deux femmes à nos communautés qui ont réellement fait une série de grands impacts dans une série de vie monde. Parfois, c'est pas là que où est moun dans Facebook ou bien où elles sont en flyer ou bien si là ça y a un award que moun a fait bonne chose, mais là que moun censé servir à aider moun de jour en jour, moun ça a toujours besoin à cadrer. And I want to say this before we even get started, before I even introduce the both of you to the show, as we end n'a fini à mois de mars là, il pas bon assez pour me quitter nous aller sans que moi pas applaudis nous parce que moi ça c'est mois des femmes. This is the month of March is Women's Month, and I am grateful to have with us today not only two women but two professional women. Two moms, and I hope I didn't mess up your sexiness by saying that you're a mom. But two beautiful people that qui accompli en pile chose dans la vie ça, et c'est un plaisir, un honneur pour moi capable de reconnaître yo, pour me connaître yo. And I again salute you both for the outstanding work that you have been doing in the lives of many. And though you are probably not echoed, your names are not echoed in the White House, in the palace, in many places, but you have definitely echoed in my life. And I think that's necessary. It is potent also that a man, a father, a brother, is telling you how much we appreciate you, how much I appreciate you, because at the same time too, believe it or not, some of the hurts and pains that you endured was by a man. So with that being said, I guess I definitely want to applaud you guys. But today, in the Mojo Show, we are doing a continuation. Nous continuons un sujet que nous avons suivi semaine passée, et pour nous ce Mojo Show, c'est nécessaire pour nous capables de gagner un partout. Nous voulons couvrir aujourd'hui, et c'est mental health and sex. Sexe avec sentimental. Peut-être dans la communauté par nous, ça c'est un sujet qui pas tellement parlé, ou bien il pas nécessairement parlé sous bonne plateforme. Ça va veut dire il pas parler non, il parler dans chambre, il parler dans locker room, il parler entre monsieur, entre garçons, famille tout là ils joignent une l'autre, ils parler de ça, mais il pas conseil de bagaille qui pas nécessairement touché dans manière ça. Et moi content aujourd'hui, semaine passée nous t'ai gagné avec nous Yves Napier, qui était un matin pour moi, et lycée un social worker or licensed counselor, and littéralement un impact pour chaque monde qui t'a suivi by là, m'te joine réponse j'étais très intéressé à ça. Mais today nous voulons comprendre perspective sur une autre phase, un autre niveau, parce que nous c'est censé une génération qui nous est plus jeune, et bagaille même le c'est une question que nous allons demander après que nous introduisons tête nous, c'est que même le sexe il a longtemps depuis l'homme créé sexe là, mais est-ce que sexe là changé en génération? Vous comprenez? So, nous avons couvert ça après que nous censés inviter nous, ou bien, nous capable de dire que introduit tête nous gagnons avec nous jeudi, nous capable de dire, semaine passée, nous gagnons, ma tante, moi, jeudi, nous gagnons cousine, moi, docteur Daniel Bailey. I am proud to have you on the show and thank you for taking the time out. You are a number of things besides my cousin. You are definitely one, a doctor. You're a mom. You're a woman. And again, I applaud you for who you are and what it is that you do. You are by way of Dallas, Texas. And the floor is yours to introduce to the public.
Well, thank you so much for having me. I'm so happy to be here. And I just want to thank you for the opportunity. Like Nicholson mentioned, I am a doctor of physical therapy, and I specialize in pelvic floor physical therapy. So I help a lot of individuals who struggle with things like painful intercourse, urinary leakage, constipation, pain during pregnancy and postpartum, individuals that have sexual dysfunction. That's a little bit of my specialty as a physical therapist. And I'm also a functional medicine practitioner. So I help people that may be struggling with chronic health issues. I help them discover the root cause of their issues so that they can experience optimal health and wellness. They're no longer in this rat race trying to figure out what's going on, but we use a holistic approach to discovering what's the cause of it so that we can heal our bodies and experience optimal wellness. So that's a little bit about what I do. Have an amazing husband, Harry, and 3 children, and we're here in Dallas, Texas.
Wonderful, wonderful. I have somebody else that I can literally call her a sister of mine. I have known her for, I think, a little over 20 years, you know, and I have her today. I don't want to make her sound old because I've known her for 20 years, but I am grateful for her and the work that she's been doing. I believe she'll be able to confirm it. She is a licensed clinical social worker, and she has been in the field for just about 20 years. And I believe that she has seen a lot of cases. So the topic that we are discussing, like you, Dr. Bailey, are not foreign to her. These are cases that she sees on a regular basis throughout her experience within the field. So without further ado, I want to present to you all Carline Noël.
Bonsoir, auditeurs et auditrices. Et bonsoir, Nicholson. Je vous remercie pour l'invitation aujourd'hui. Tant que dit, moi, j'ai longtemps, moi, dans le field, over 20 years, I've been doing this, and I've seen a lot. J'ai commencé dans préventive. Côté préventive, c'est plus qu'est-ce que nous avons, c'est qu'est-ce from ACS. And l'école, you name it, docteur, so les envoyer question à nous. Comme autant de préventive, c'est pour nous prevent, si nous pouvons aller dans foster care. And then après, on a parlé de ratio parce que je ne vais pas trop long. And then, from preventive, après ça, je travaille dans l'autre camp qui foster care. Côté que nous travaillons avec tout le monde qui est dans foster care. Dans foster care, c'était plus pour nous, pour tout le monde retourner, ou bien pour nous adopter, ou bien independent living. Ça qui est déjà dans le système. And après ça, from that, because this is the reason I love social work field, because it's huge. You can do a lot. And then from there, dans le travail plus avec grand monde, that was more clinical, parce qu'on a fait individual counseling. So there, I'm going to tout bagay, you name it. Côté monde, yo halluciné devant, so yo me transformer l'autre figure, m'a moi-même encore. So I have seen a lot. So thank you for your invitation.
Wonderful, wonderful. Thank you both. And again, I think it's great that we have two women that is on the show qui a parlé d'un sujet comme ça, that is being asked from a man. Because en pile de fois, conversation ça yo pas faite entre eux, mari et madame, en pile fois conversation ça yo pas faite entre eux, boyfriend, girlfriend, and definitely conversation ça yo pas faite with abusers. Conversation ça yo pas faite avec rapists, you know? So, li très important, conseil du bagay, moun pa pale de yo ta pito bliye yo, you know? Gen moun, some people, they change their address, change their country, their environment, so that they can forget the trauma that they experienced throughout their lives. And those that were not able to change their environment, it has certainly changed them. It certainly changed them. So again, I'm a person of detail. Moi, un pile détail. Ça va veut dire moi mais sauce, non? But I'm a person of detail, and I say that because again, c'est un garçon qui a demandé question ça. Et nous déjà connaissons, physiologically speaking, ces garçons qui toujours comme si the giver et femme non c'est receiver. Sometimes the giver does not know the pain that the person is receiving. Yeah. So that's why I want to jump, m'vle rentrer dans le sujet parce que le bagay yo commence bon là, connaît l'heure pour passer nous pas demander tout bagay, nous avons une liste de questions pour demander nous. So the first question that I want to ask, and this is for the both of you, as you guys are practitioners, as I said before, sexe là depuis le commencement du temps. Nous ne pouvons pas parler de manière biblique, nous ne pouvons pas parler de manière évolution. Depuis nous fêtes, nous tendons à parler du sexe. Est-ce que nous sommes capables de dire comme practitioners and individuals, est-ce que nous sommes capables de dire que sexe est un bagay qui changeait pendant le temps a changé? Is sex something that has changed mentally over the course of generations? You know, and from your perspective as an individual, would you say that sex has changed? And I think that's important because different people view sex differently. And they say that Ivna Pierre last week said to us that sex begins in the mind. So the floor is yours, ladies.
Well, I'll start by saying I think that generationally, what I've experienced, and even what I now notice as a clinician, that is it has changed, and that I think that, you know, when I was a kid, or maybe even a teenager, there wasn't really a lot of open conversation, at least with even parents and children, about sex. It was always this hush hush thing. You know, I'll even say, you know, growing up in a church, right? You just don't really talk about it much. And most of your learning comes from school. But I challenge that now as an adult. And just with the patients that I serve, that I think there needs to be, there is more open conversation now about sex than there was years ago. And I think that makes a difference in how people view sex, because for some people it's this hush hush thing. You know, if you have these sexual feelings, maybe you're suppressing them because, oh, I'm not supposed to do this right now. I have to wait, you know. And I think that poses a problem when you can't really be open about, hey, these are the desires I'm feeling sexually and I'm suppressing them. I think that poses a huge problem, because when you do get into a relationship where you are intimate, I think that can really affect your experience. So I do feel like it's changed in that, you know, with social media and the internet, people are a lot more open and free about, you know, talking about sex. And I can see that significantly from the generation, you know, of my parents to what I experience now and to the patients that I serve. So I really do think it's changed.
Awesome. Colleen, what are your sentiments?
Yeah, it's the same thing that she just said. Le nou tap grandi, et puis tout, à l'église, vous connaissez. Dans l'église, especially, m'avait particulier l'église. But tout connaît dans l'église, c'est tabou, ou pas parler de sexe, vraiment. Et la caille, nous, le nou tap grandi, même le que ou ap de tout le monde, ou pas même cabine la caillou avec moun nan, en pile fois. C'est dehors ça fait. But avec génération moins, avec kounye la moins gon teenager, it's different. And then client tout m'observe yo tout, li vin mette là moi même tout parce que m'de commencé faire travail ça avant que m'de gen Christian, que I thank God for that. Li fait moi le bagay dans différentes perspectives. Parce que pendant que dans préventive, m'de kon fait classe parents. So, on bagay m'de kon fait avec parents qui gen teenager yo, c'est de ça m'de kon parler ensemble avec eux. Parce que les parents yo vinn côté moi les gon teenager, les gon ti moun k'ap date, les vini yo nem ti moun ta tout vieux non ki nan book. Just parce que ti moun n'a date. Vous comprenez ça me dire non? So c'est là l'en fait classe parents yo ou éduquer yo ou dit that's good, at least petit tout ka vinn catholique ka vinn parler ensemble avec ou l'elle fait ça. Ou pour y faire tout paquet bon bagay parce que l'elle saute dehors ou pas contre ça qui passer. But si nous mettons dans kan ensemble avec on a grand paquet bagay qui capable passer. Gen chance pour en pile bagay qui capable passer. So yeah, différent kounye là nan pile kay et moi même pour comparer mon teenager les différents la kay moi tout parce que même les son petit garçon me dit if you're dating someone me vle pour mener moun ça la kay moi parce que me besoin qui est ou deal ensemble avec parce que pas seulement petit fille petit garçon yo tout nous supposé protéger yo.
Right.
Donc pour répondre question hier les différents dans en pile kay mais nous still gon paquet travail pour nous faire.
And you know, Colleen, if I may ask, because you mentioned or you alluded to the fact that you have had clients that you've had parenting classes with that, in particular, with our culture in the community haïtienne, parents par contre nous capable dire bon en pile parents par contre qui gens pour you parler avec Timonio de sexe et pour you même they try to, I would say, scare the child out of not going into it. Pour moun k'ap suivre, pour auditeur yo, qui sort de message ou peut-être capable partager avec you. M'kwe gen peut-être maman k'ap suivre, gen peut-être moun qui peut-être gen moun yo connaît gen petit. Vous comprenez? Gon c'est du parents yo peut-être pas vle penser que petit yo la donne. Vous comprenez? Ou bien gen parents qui pas vle penser que petit la connaît qui j'en pour le faire pi bien parti le tout. You know, the child could actually be the teacher. But how do parents engage their children in a conversation like that?
But the thing is that, parce que bon m'dou, ou pa ka ba ou bagay ko pa gen, right? Sou televe non kay kote, c'est ça pa on ba ou. So lo vin gen petit pa, that's what you're gonna give. Until nous bagay arrive, until ti moun nan vini avec ventre li gros, ou bien si ti moun nan still underage, la l'école ou bat li, yore les SIS, pou y a lò komanse vin pran service, se lè sa wap fè, oh, lè ou komanse a, parle ensemble avec ou, di maybe, si ou te open, if you open up a little bit avec ti moun nan, maybe sa te kapab fèt. Ou pa di pa nan sa non sans judgmental, non, parce que ou pa ka juge moun ki pa kon nou bagay. Ou kompren? But ou teach them, ou parle ensemble avec eux, ou vini, ou descend dans les voies côté eux, et puis pour montrer ensemble avec eux côté yo ta supposé, maybe si yo te là, que ti moun nan pa ta poual li pa ta poual ka next zone neighbor, pour la faire une série de bagay, ou bien li pa ta poual déguiser tête li, à mettre tête li non gens non gens que il pas supposé mettre tête li pour notre trouble parce qu'en pile fois il y a des gens qui notre trouble même moi même les policiers qu'on après les pour venir prendre monde ça à cause de relationship que me get ensemble avec eux dit mais qui ça t'a pas le faire ou comment ça veut quitter l'école oui elle fait tel bagay but si pas en petit gens open ensemble avec eux pas dit pour laguer ba petit tout. Mais bon côté au cas ensemble avec Simon nan si week-end nan arrivé Simon nan parle dans movie il gen doit dire mami I'm going to the movie il pas besoin bon menti dire quoi quand l'autre zambi et puis à l'autre côté vous commencez à dire tout bagage c'est communication Simon n'est pas un mouli il that kid will never be your friend this is your kid but go gens parle ensemble avec lui comment ça me donner those boundaries you have to set boundary supposed to get curfew all of that they will put all of this in place. So there is no reason to pour une série de conversations pour pas parler ensemble avec lui, with respect.
Well said, well said. Dr. Bailey, if I can ask you, again, culturally speaking, ou même qui fait face avec peut-être Kasayo, we can say que sexe respectueusement parlant, parce que ça son adult show, nous va connaître si tout le monde cap suivre, mais pendant ce temps, nous sommes capables de dire respectfully que sexe c'est un bon bagay. Granted. But at the same time, it can be a very sensitive thing. And I'm not meaning sensitive physically, but more so mentally or emotionally. It could be something that is very sensitive. How does, and help me to understand if you have seen this before and how you dealt with it, how does a parent deal with a case of, how does a parent deal with a case where a child in their home was sexually assaulted by a family member? And again, that's why I say this is culturally, because gan pil moun li telman yon bagay ki kapab di bon ki it's a norm. Sadly, that things like sexual assaults violations has taken place in a home. Et question ça c'est une question qui est très vaste parce que le n'a pas de moun qui victime non. I mean, of course, moun qui victime non, mais pendant ce temps maman victime tout. Mentally papa ka victime tout because li capable de vivre ou le que moun nan bon pas dire c'est papa qui fait ça parce que li ka different people li ka maman li ka ma tante li ka mon oncle but how you know that type of trauma how do we deal with that how do we move on from that how do we get healed from that
yeah
you know and just the ripple effects you know because how do we prepare an abused or a traumatized person for family, for marriage, for lifestyle? You know, and we're gonna go ahead. I want you to answer that question, and there's some other components to that question that I'd like to ask furthermore.
Sure. Well, I think one thing that's extremely important and crucial is that child has to get mental health, has to go through some counseling. And I think even culturally, counseling used to be considered this, oh, if you go to counseling, you're this, person who is weird or is crazy. And I hate to say the word crazy because I'm very sensitive to people that have mental illnesses. But I think that for victims who have been, sexually abused, especially in the home, they would benefit from the support of parents saying, hey, baby, I need you to go to counseling because this is going to be a journey that's going to affect you throughout life. And I think when a child who has been sexually abused goes through counseling, it makes it so much more manageable for them when they get into other relationships, when they go to a doctor's office and has to get an examination. Even myself as a therapist, I had a patient recently. Typically, I do an exam internally for patients with pelvic floor issues, and that individual did not want to do that because of her past. She was traumatized by what happened to her in the past, so I couldn't do my regular examination on her because of her experience. Now, I think that when someone does go to counseling, ongoing counseling, to really get the help and the healing from this experience, they really are able to support themselves better. I don't think you really get over it. I think you manage it better in life. You're like, okay, this happened, but now I know how to handle this new situation. Because I don't think you'll ever forget. I don't think you'll forget this ever happened. But I think in a healthy way, move forward from it where I know this has happened to me. This was traumatic, but I now have the tools and resources to be in a healthy sexual relationship and to go to a doctor's office and not have this fear of feeling traumatized again.
Right. I think that's powerful. Can Carlene Noel, can you give us not research, but give us some background on different types of not cases, but how does that damage a female or male mental state in a case like that? How does that damage that individual?
Well, evaluate from cases to cases. Gen moun le ou vini, I mean, gen la dan yo snap pa le jan li affecte yo, gen pil moun ki very promiscuous.
Est-ce que c'est faute li? Parce que conseil de parents haïtiens, yo remen di se ou te chercher ça, ou on prend sous pat lan fait tel bagay, ou pas t'a joindre chercher ça kounya là, maman a joué petit li bousin, excusez l'expression, a joué petit li ceci cela, ou on prend when they did not find that. You know,
pas réaliser que c'est traumatise ti moun encore de ça tout passé. Parce que en plus fois moun qui sexually abused, yo fin perdu sens self yo. Vous comprenez? Grand pile là de qui blème tête yo, yo dit si m'bat dans telle position, tel bagay va ta fait. So imaginons moun depuis le petit ça arrive li, et puis si moun la ka li a blème ni. Et puis kounya la grandi. Vous comprenez ça me le dit non? So li pa vin gen un self of self qu'il faut un moun sa jodi ensemble avec moun sa jodi ensemble avec en pile fois raison les demander pour qui raison qui fait au conseil parce que je dis comme ça kounya I am in control parce que c'est un controlling thing qui fait au faire ça parce que now I pick and choose who I want to be with. I pick and choose when I want to have sex. Ou pas ka di en allant dans boogie maintenant en allant bakaban nan tout genre de bagay ça yo use. You're in control now. If I want to be with you today, ma pense ma voix jodi an. Moi prochain si m'vle pour l'autre monde, that's what I'm going to do. So it's more about controlling thing. Et ça fait presque depuis que nous qu'est-ce qui moun sa té en victime, M'pa remere les victimes devant yo. So depuis me nous case comme ça qui ça me fait première fois me dit thank you for coming. You are very brave for doing this. Ou comment ça me dit là? So même power yo. Ou comment ça me dit là? And at the same time too, yeah. And at the same time too, don't pas que parents ou est ka blame ti moun yo. Raison qui fait ou faire ça tout. Et pas faute yo non, gen pile la de sexually abuse themselves. So admit que petit yo sexual abuse c'est comme si yo même y a pas admit bagay pa yo non denial, yo so much in denial. Kounye la tant pour yo di petit tout, I'm sorry. Oh si peut-être que non dans tête si m'bat qui ton mal travail ça va t'apprivo. So instead of di si m'bat fait tel bagay ou bien si m'te protège plus ça va t'appriver. Best thing yo même pour yo capable sentir en forme à tête yo c'est blame ti moun nan. Parce que yo pa vle prendre responsabilité for it. Ou comment ça veut dire non? So qu'est-ce ça son série de bagages qu'est-ce qui very sensitive. Ou comprendre ensemble avec like Miss Belly said no matter j'on travaille ensemble avec client moun qui te sexual abuse you can go get a little control no vie to ko le aller dans GYN li ka easy pour yo bien les update li contingent easy pour yo retirer mais c'est bon bagay y a chamblier bagay ka get easier for them in the long run and the le gen petit yo tout pour yo parler de ça but ça son bagay de tête que la toujours là.
Wow. You mentioned something and I want to ask the both of you guys this. Okay, I'm sorry. Go
ahead. Then one thing that I want to say pour moun captain de mieux, no matter Jean ou même l'autre sans là-dessous, si moun vini faire sexe ensemble avec ou, you not to blame for it. Ou pas tête au problème. Quel que soit Jean t'es habillé, ou pas provoquer pièce moun pour venir faire sexe ensemble avec ou sans que ou pas consent to it. So de ou pas consent pour faire li ou moun vini li prend avantage sur lui ouais puis sans qu'on pas dire ou pas d'accord that's rape and then that's not your fault.
Comme si que on paraît ton côté on paraît ka un monde et puis moun nan tout fini m'gen envie moun nan moi coucher moun nan I that was not consent.
No.
That's what you're saying to me. Non, parce que non, et raison que moi dis ça est parce que scénario que vous bailant, c'est un scénario qui fait un pile dans cas haïtien parce que spécialement gain m'pa konn pour Texas, mais New York, Brooklyn, cas haïtien toujours gain moun. Cas haïtien toujours gain petit moun. Ou comprendre pot toujours à rentrer moun toujours à rentrer sorti ou comprendre ou gon ti moun 12 ans qui gon forme moun 19 ans 20 ans. How do we that person, that friend of your mom or the person that they call cousin and you don't know how they your cousin. You wa kon ki jan e ba frère maman e ba frère papa e ba petit yo ni cousin on zami famille et puis moun nan rentre et puis li fait yon déblojay dans famille et puis kounya la. So are you telling me that person et pour moi comprendre mais I want you to say clearly m'dano dire clairement pour moun k'ap tande yo dans société nou.
Oui, yeah, donc si m'gen un petit moi qui gen 12 ans, il fait chaud. Et puis ti moun dans chambre ni. Li avec un petit soutien sous li a un petit pour short sous li. Et puis on vient ouvrir porte là ou entrer. Normal des gens petit moi look. Ça veut dire pour entrer dans chambre pour dire t'a provoqué ou juste entrer ou faire sexe. That's rape. Vous comprenez ça me dire là?
Right.
Si on ou gen boyfriend ou te get en parler depuis non c'est comme ça me l'habiller pour ou non venir you go to your room you do your thing that's fine. But pour moun vinn la caillou juste pour moun vinn la quand même les grand moun moyen mandan kay moi li fait chaud met ti bout pantalon sou mon ti à côté sous moi et puis kounye la pour garder pour dire gen longtemps d'ap gado comme ça puis même moment pas ka contrôler Dieu pour prendre frapper dans mien and you do what you have to do and you leave. That's rape right there. Simple.
Right. Right. I want to make sure that we answer all the questions, or at least some of the prominent ones. But low self-esteem and sex. What can you guys tell me about that? Low self-esteem and sex. What does it look like? You know, mentally, clinically, what does it look like? What's low self-esteem? And is that even a diagnosis? Is that even an issue?
Yeah. I don't know if it's actually a diagnosis that you have a ICD-10 code for, if you would.
Can't bill for that.
I don't know if you can bill for it. But I do think it's a prevalent issue. I'd say, you know, I'll start with women. For women, it could be, you know, if in my upbringing, I was told to suppress these sexual desires until I'm married, right? I have to suppress them. You may, once you get married, you know, you may feel, if that's what you do, if you wait till you're married to have intercourse, you may not feel that you're really able to express yourself, because all this time you've been suppressing these feelings you've had, and now you don't really know how to operate in a relationship.
Mm-hmm.
Another example of low self-esteem would be if your partner would say things like, you don't give it to me like I'm used to, or you can't perform like, you know, what I've had in the past. Then you always have this mental notion of, I'm never pleasing this person. You know, I think that can be another reason to low self-esteem. I also think, you know, if you're one that may not have had a lot of partners in the past and the other person has, you may have this comparison, you know, oh, this is how this was for this experience. Can I match up to this experience? That can, you know, cause low self-esteem. And then for men, I would say, I've had clients in the past, you know, who complain about, and I know this was another question you may have had later, but they may feel, oh, is my size not the size that would be pleasurable for my partner? That can cause low self-esteem. Or I can't last long. I'm not lasting long, you know, and I don't know what to do. I'm pre-ejaculating, and this is an issue for me, and it's causing me all this stress. You know, these are common conversations that I have with men that I deal with in practice. And these cause issues of low self-esteem and feeling like, wow, I can never really provide this pleasure to my partner because of these things that I'm thinking about when it comes to sex. So I think there's a lot of different variables that can contribute to one's esteem and how they feel about sex.
Wow. Very, very well said. I think that's something that we want to expound on very, very quickly. But I think you posed a very good point, particularly within the Haitian community. You know, men are, you know, well, not just in the Haitian community, but altogether, men, you know, have these conquering concept. And I don't know, that's definitely something that I want to do the research on, and to find out, est-ce que garçon peut-être fait plus expérience avec low self-esteem sexually que fille? Because at the end of the day, men are usually the givers in that. Na communauté haïtienne, il y a une série de petits jus qu'on a vendu, il y a des jus que les joues, there's a bunch of them out there, because the men, as you said, Dr. Bailey, they have this tendency of wanting to please. Et ça son bagay que garçon pas parler de lui. You know, especially in the community haitienne, in the Haitian community, we don't see men express their their low self-esteem differently. Colleen, how would you add to that as we move on to our next question?
You know, bagay que moi je viens en pile, on a parlé de self-esteem dans tout avec dating. spécialement pour teenager nous yo, en pile fois la caillou, parents yo ou bien whoever caregiver que yo gen on t'a levé yo hein. Et puis on a grandi ça dit là. Pour le craser self-esteem ni. Soit dit mon oh regardez gros son non ou bien ou trop gros ou bien ou trop petit ou bien ou pas comme ka clean corps ou pas comme ka do this quand y a les ti moun sa a long relationship quand y là li either senti li trop gros pour retirer rad sous lui ou bien il là dans équipage le demander do you have a boyfriend oh gardez gros sem qui est-ce qui peut le prendre et le gars ti moun on dit pas gros parce que ça of course li plein ou comprendre but li pas gros mais à cause de la caille tout temps a dire comme ça que ou manger trop ou garder figure fait si yo pas ouais si c'est quasi self-esteem ti moun nan donc des fois self-esteem nan sorti tout en dans caille ti moun nan qui fait living gain low self-esteem.
Okay, good. Sex and depression is that well, sex and depression, I want to ask, could someone be depressed because they're not getting enough sex? And vice versa, can that person be depressed because they're having too much sex?
That's a great question. You know, I don't really.
And I'm sure that people are saying, who gets depressed over having too much sex?
Yeah.
You know?
Yeah.
You know?
Yeah.
But
so I don't know. I don't know. Maybe there's some research anecdotally to support that. You know, depression from too much sex. I don't know. I'll say from a medical standpoint, you know, there are individuals that have issues like diabetes and heart disease, or may have some type of medical condition that prevents them from having sex. And I think that can cause the depression, because it's something that you have the feeling inside, but maybe you're dealing with erectile dysfunction, and you just can't have intercourse. Or maybe for women, you have a lot of pelvic pain from either some traumatic birth experience, maybe some surgical procedure you've had in the past, and you can't really enjoy sex or have sex like you used to. And so in that regard, your hormones may be saying, I'm ready for some, but physically you can't. And I think that can cause depression.
Depression. Okay. And that's right on that. I want to add, when it comes down to medication, especially with the men, some of the medication causes erectile dysfunction. Monsieur qui nos communautés haïtiennes qui peut-être yo gen tension, high blood pressure, et puis docteur fouille yo son médicament, et puis bon, j'en ouais un pas gen vie en bas encore. Everything is dead. That's a discussion altogether, because we could imagine how the relationship is struggling because of the lack thereof. But I want to move on to a next question, is anxiety and sex. To piggyback off of the erectile dysfunction, you know, people don't realize, and you guys can allude to it too, you guys could, don't realize that anxiety can make and this is both female and male, because a lot of times a female might be, you know, I heard a little story, c'est comme t'es un jeune homme qui était alcaï en petite dame après il saute là en dette, et puis là que il saute là dette là, il rentre la caille petite dame là, et puis il chita, il commence à parler, et puis il commence à faire, et puis le monsieur retire le pantalon sous lui, et puis petite dame là dit, oh, quand on parle la grossesse ciseaux ça, c'est pas mon on va le faire. so she was scared, and she literally, though it was funny, but she literally said, "No, I don't want to have that." And anxiety can be definitely a level of fear, you know. So talk to us about a little bit about sex and anxiety.
Gon illustration Miss Pierre te use pendant première partie semaine passée que vraiment aimé, là te use stick là. Je considérer en bas pour moun qui oh non, il était plus usé pour I think bipolar, pas pour anxiety.
Anxiety, right? She did.
But anxiety en tout presque me dit parce que l'homme anxious when moun nan constant et à travail. Moun anxiety, li worry plus que n'importe si bagay, li worry over little things. You comprends? So, moun qui get anxiety, li ka impact you sexually parce que yo pas là vraiment vrai. Mentalement de here et nous connaît loi faire sexe. Si mentalement on pas là parce que mentalement li connecté avec quoi. So, si mentalement ou pas là ou préoccupé avec un autre bagay qui passe dans bon nous. So, ou pas fonctionner. Ou pas rien. Vous comprenez les deux là? So, on pense
hein? M'di pas diable monsieur.
C'est pas seulement monsieur tout mais d'abord tout. C'est tout de gender. C'est si monsieur en lui-même li worry, li gon pas que bonne bagaille passer dans tête li. Li pas camper. So fi en lui-même quand on connaît, li pas get wet, li pas mourir.
Right.
So ça veut dire il y a pas qu'à faire so c'est la living impact you know to the gender. Vous comprenez ça veut dire in terms of them having sex.
Wow. Dr. Bailey, do you want to add anything?
I agree with Carlene, what she said, 100%. I think too, kind of going back to the self-esteem thing, if you have this idea like, oh, is this gonna be pleasurable for the person? And you have this, you're constantly thinking about that as sex, I think that also can affect your experience. So you have the one extreme, like Carlene was sharing, you know, you may be dealing with anxiety as a whole, as a person, you just have this anxiety issue where you're always anxious. Then you could have anxiety specifically about sex. Oh, it's gonna hurt when I have sex because I just had the baby, you know, 3 months ago, and it hurts down there. And so all these things can contribute to anxiety in sex.
So what do we call if you have a client that comes to you that is saying that, look, I'm not necessarily being aroused down there, there's nothing flowing in my relationship anymore. You know, what do you say to that person? On moun vin nan clinique pou yo di bon, mba konnen moi que physiquement mba wè comme réagi, jan ta dwe réagi lè que moi rentre dans relation sexuelle avec mari. You know, since you deal with different types of pelvic exams.
Yeah.
You know.
So I first kind of ask lots of questions to figure out what might be that root cause. Is there something going on in your relationship with your spouse? Is there some tension going on? Are you having stress? Maybe there's nothing really going on between you and your spouse, but maybe the kids are stressing you out. You don't get a mommy break. And I'm speaking from a woman. Things can happen to a man as well. But what are some contributing factors? And then I can ask the question, okay, if it's not the relationship, if it's not that you're stressed with life stuff, what's going on hormonally? Are you having some hormonal imbalances that's affecting your ability to have this sex drive? Are you on medications that have side effects of decreasing your sex drive? So several different factors that can contribute to, I'm just not feeling this down here anymore. It's just not going well. We want to look at, what are those factors that contribute and are the pieces to this puzzle of not feeling that sexual desire.
Wow. Does sex really relieve stress? And I'm looking at the time because I see the time is racing, and I think there are two other questions that I want to ask. But does sex really help for stress? I mean, and I'm not asking you guys personally. I'm asking you guys as clinicians. They say, I've heard people that are not clinicians, but in conversations, particularly women, I've heard women say, man, I'm stressed. And their recommendation is, you need to go and have some sex. Does it really cure stress? Because what I don't want is for people that are watching the show pour moun kap suivre émission pour you di bon stressé, c'est son sexe mon besoin qui pour aider avec stress là. Is it true?
Nou pa pou pièce moun al fè sexe.
Nou pa bay médicament ça.
Nou pa si moun al fè sexe, but yes, sex is very, very good for body, mind, and soul. Parce que lò fè sexe, d'après en présentation que moi te gen nan agency dernièrement, lò fè sexe, li release sacré le sérotonine. Et ça fait un pile fois, et lò release li bon parce que on moun qui lò fè sexe, ça le fait li montel. Qu'il faut capable boire bien, ou qu'à travailler bien, ou gain plus énergie parce qu'on connaît un monde qui gagne le sérotonine, you very agitated, you low key, things like that. So monde qui fait sexe, c'est tout cool, ça le fait li montel. So, and then les tout c'est une raison tout en pile fois, l'homme on finit faire sexe, ça gagne pas fois au sens où relax. Gagne dominance. Descendre tension. Puis c'est tout bon bagaille yo.
Oui.
You can't really sleep parce que ou gen intrusive thoughts ou toujours à penser ici voilà bon l'autre fait sexe qui sont fait ou dormir.
Aïe yes. Wally.
Totalement.
Oui. Your mind is at rest.
Going. Everything that comes with it.
So with that being said, I have to, even if we don't ask any other question, I want to ask this question. What do we say to people? What do we say to people that are having better sex mentally than physically? M'pa kon si ke m'man des questions bien. Qui ça nous dit pour moun qui censé qui gagne plus sens parce que nous t'ai déjà répondu question semaine passée. Yves Napier te répond, il dit oui, sex is mental.
Yeah.
OK? Qui ça nous dit avec moun qui dit que li passe un plus bon temps sexuellement, mentalement que physiquement. Physiquement, bon, nèg lan c'est lapidel, craser, ou on prend il va un lap faire, ou on prend c'est plus frapper que li joindre et puis maintenant penser li passer un moment qui très amoureux, un moment qui très comme si qui très fantastique ou bien fantasy. What do we say about those people that enjoy their mental sex encounters than their physical ones?
Well, Sam dit sex li tout deux, li physiological and then li psychological. Parce que li connecté à nous. But li plus mental. Une raison qui fait ça parce que moun pense que qui dit comme ça que les fait sexe enjoy les plus mentalement et parce que il y a communication, et parce que you're happy pour l'autre, et parce que maybe si nous faisons conversation là, laissez-moi ensemble avec vous, si nous faisons conversation là, je commence pour finir. Vous comprenez ça me dire là? So, il y a une balance là. Vous comprenez ça me dire là? And then, ou connaît ça partner besoin, partner connaît ça besoin, nous tous de connaît qui satisfait l'autre. Ou connaît qui parti dans partner ou qui turn you on, keep you on le turn on. Vous comprenez ça me dire là? So it's a combination of knowing your partner and know how to satisfy your partner. Vous comprenez ça me dire là? Can the partner happy? So happiness is a biggie in having sex.
Right.
So it's mental and then care to la donne tout. Comment ça me dit là?
Right. Dr. Bailey?
Yes, I agree. It's a mental and physical thing. I feel that, again, I kind of asked the question, what's the root cause? Why do you think you have this pleasure mentally, not physically? What's going on? What's going on in your relationship? Is there a hormonal imbalance? Do you have a lot of stress going on in your life? Why do you think you have this mental pleasure, but not this physical pleasure? Because you want there to be both. And like Carlene said, that's communication. When we talk about sex languages and how you communicate sexually, I think that's very important too. So looking at those root causes, figuring out what's the best way to communicate sexually with one another can help improve this disconnect between the mental and physical when it comes to sex.
Last question before we leave. Alter ego versus bipolar in sex. Because, garçon you peut-être gen yon ti madame qui très quiet, de la dans société, on prend ces petits mouchoirs, couvrir, mais le la kaili dans chambre ni, garçon dit et pas même si mari parce que si mari monté, si mari pas qu'à descendre. So what's the difference between alter ego and bipolar, in particular in sexual relations?
Well, I think that with alter ego, it's more of a conscious decision. It's
okay.
I'm gonna be, Superman in the bedroom, okay. Or I'm going to be Sasha Fierce, like Beyonce in the bedroom if you were a woman. Whereas bipolar, and I'm not a mental health therapist, but it's more of a chemical imbalance that causes one to act in a certain manner. That's what I feel is the difference between the two. I think, in the bedroom, you are this different person when you come there, but you have made that conscious decision to be that in the bedroom.
Wow. Okay.
Where bipolar is, no, I have this chemical imbalance that affects me mentally and affects how I act.
Awesome. Colleen, what's your take on it?
Oh, well, Dr. Bailey gets a refoni, mais ça me dit pour bipolar, donc nous voyons le bac dans ce cycle hémisphère qui c'est côté mon manic and the depression at the bottom. So ça fait que des parfois où donc scénario dit mon doit get ti mouchoir et puis les l'ensemble I mean
c'est igual
the manic stage qu'on y a là qui kicking ou comment ça
là igual là tout.
Yes.
Ça ton gap.
Manic stage là kicking qu'on y là so where mon sali vraiment but bipolar manic stage avec depression donc qu'on gagne manic stage avec depression donc qu'on gagne médicament pour lui vous comment ça me dit là so là mon non médicament là mon devant médicament pour bipolar donc où elle vient balancer parce que son chemical imbalance so là mon non médicament qu'on y a vient balancer où mon non donc pour le level.
Right. Okay. Beautiful. Ladies, again, I can't thank you enough for today. I want you guys to be able to tell the audience just some tips that can help them mentally in the sexual realm, that can help them on some of the points as we end, some of the points that we alluded to earlier on. What would you be able to tell the public today on when it comes down to mental health and sex?
So I'm capable de when it comes to mental health and sex, especially the sex piece. Depuis no commencement qui ça te gagne c'est communication, right? So c'est une bagay là encore pour gagner, they're very powerful. Là on connaît comment pour you communicate, get to know your partner. Ou comment ça me dit non kon sal remen sal pa juste parce que mon en fait font ti moun kounye la pour un ça down ou bien pour fille tout en pile fois juste parce que monsieur gagne nous tirer pour put les down. Comment ça me dit non? À la minute que gain pulling down dans relationship, bon paquet de bonne bagay qui commence à mourir. Ou comment ça me dit non? So advice d'abord c'est communiquer with your partner sous parent mon bagay, expliquer partner ko parent meni. And then pour parents yo tout, talk more with your kids. Talk to your kids. Parler sexe ensemble avec si moun yo, parler danger qui gen dehors ensemble avec yo. Si on don senti on n'a pas la petite ou senti pareil, dites pas quitter petit tout comme continuer à parler ensemble avec moun ça ou bien pour trust moun ça ensemble avec petit tout.
Beautiful. Well said. Dr. Bailey, any last words?
Yes, I would just say that sex is supposed to be something that is pleasurable and enjoyable. It shouldn't be something that's painful. It shouldn't be something that's giving you anxiety or depression. And if you experience any of those things, don't suffer in silence. Get the help that you need. You know, see a therapist, see a pelvic floor therapist, get the support so that it could be something that you can enjoy thoroughly. So that's
beautiful. Dr. Bailey, I know that you're as you mentioned in Dallas, Texas, and I know the Mojo Show is kind of everywhere. Dr. Mona Lisa and Johnny, they're pretty much everywhere. Where would somebody be able to reach you if they happen to be in Dallas, Texas, or when it comes down to telehealth? How would they be able to reach you, and if you could share that information with us?
Sure. My website, I have a contact form there. It's www.360hws.com. 360hws.com. It stands for Health and Wellness Services. Well, 360 Health and Wellness Services is the name of my business. They can find me on Instagram at 360_health coach. You can send a direct message there, and I'll be happy to help support you in any way that I can.
Wonderful. Carlene Noel, I know you kind of work with us at ARA, Emotional Wellness Mental Hygiene, and we're looking forward to doing several workshops with you within the community. But if someone wanted to get in contact with you, how would they get in contact with you? Maybe via email, possibly?
Well, I have a private email. I don't have a business email.
Okay. All right. So if anybody wants to get in contact with Carlene Noel, please email us at araemotionalwellness@gmail.com. and we will forward that information to her. Thank you guys so much, and thank you, Dr. Mona Lisa and Johnny Celestin, for this opportunity. We hope that everyone enjoyed the show. Please share your feedback, and if there's any way that we can help, we're looking forward to doing some more shows with the both of you with your area of expertise. And we will follow through with you again. Thank you again, and enjoy your evening. Good night, everyone.
Good night.
Good night. Thanks for having us.
Thank you.
Yes.
Never found someone like you.